Awesome, guys. Well, thanks for coming. First, the question is, do you guys know what athletic pubalgia is? Okay. Yes. So, you do. That's a good thing, because I presented in front of people who didn't. So, one of the main things is that this is unknown. And a lot of people go through different protocols, different rehab, different PT stents, different orthopedic surgeons, different general surgeons. And they don't even know to look for this. So, a couple things that I've been going through. History of this, you basically had a mechanism of falling, splitting, which we see a lot in tennis players. You can see soccer players, which is very evident from. And then one of the main groups also is hockey goalkeepers, because of that lateral movement, which we know, okay, has a lot to do with a lot of attachments with the pubic symphysis. So you can see the MRIs that we have here. Some of them are myself, because I actually have athletic pubalgia, and I've had 3 surgeries since, which is why I'm doing research on it. So as you can see through some of the arrows here, and then especially right down here, you can see here, and then right here you see that inflamed tendon. So the rectus abdominis, the transverse abdominis is being pulled off. And then you can go through and see some treatment protocols with this. So injection treatments, which you've seen. Maybe some people have done PT re-strengthening, mobility exercises, but also injections into the adductor magnus and things like that. So then more PT, more rehab protocols. But also one thing that I haven't seen a lot of doctors focus on, if you were Dr. Brian Buscone, who actually did my surgery from the Mass Memorial, very evident with doing this type of surgery to fix it, and direct repair versus mesh repair. So when we have them after, are there things that we can do as chiropractors, whether it's muscle, whether it's soft tissue, anything like that for those areas? But one of the main things which I'm kind of looking on is thoracolumbar junction manipulation. Has that helped? Because that's the main area that the nerves are coming from that are innervating those muscles. So is that something that helps them? Has to be looked in more, but then also protocols. Can we get them to have adductor strength? Can we get them return to play in what has been seen in those 48 weeks? So if you've seen one of the big players who is a 16-year-old Breck Shea from FC Dallas in the MLS, he was on the national team, played for a little while. He actually went to Orlando City, obviously the Orlando City MLS team. Has had surgeries, and now he's unfortunately kind of back and forth through starting lineups, back out protocols, and he's been dealing with this a lot after surgery. So again, it does have a lot to do with being able to diagnose this early and finding it early, and then treating them, going through the protocol so they don't have to end up at surgery. So hope you guys learned a little something, or maybe you can even ask questions or add to it, in your knowledge.
What would you suggest is a couple of top tier exercises that our athletes can do to prevent this? What did you come up with?
So the top tier exercises that I'm talking about here are the Copenhagen adductor exercises. So obviously, laying down on your side, and then also being shown that can we isolate that adductor strength, but then also has been seen basically in myself as well as isometric holds for the transverse or rectus abdominis. That has been shown to really help increase the strength of those areas and make them more stable, so that when they do move laterally, that they do have that, not only strength, but the mobility to move in that area what their sport requires.
And was there any criteria that they were using time-wise before suggesting the MRI?
So they did use criteria, and it was basically just mobility of the hip joint. And that's why kind of in here I showed the, right here with the femoral subluxar impingement and cam impingement. So they wanted to hold off on that to see, and if they were getting locking with the internal rotation and getting the pinching and a lot of pain. Yeah. After about 2 to 4 weeks of PT, they would then do this and then see if we can see. Well, this one has the Valsalva, but this one here you can kind of see on the outside. You'll see the hip pop up later, but I didn't really go into that. You can see the impingement of the adductor magnus when they did eventually go to the MRI.
Good job.
Thank you.